Welcome to beautiful Franklin, Tennessee. My name is Trent Nessler and I'm a physical therapist. Been a physical therapist for over 20 years, primarily in sports medicine. Today I'm going to be talking to you about blood flow restriction. Blood flow restriction is something that I've used personally in my practice for over 4 years. With over 40 to 50 different exercises that we use blood flow restriction. The beautiful thing about blood flow restriction is that we can use it not only as a part of our rehabilitation process, not only with our ACL reconstructions, but we can also use this as part of our performance enhancement. So I think there's a lot of myths and misconceptions about blood flow restriction. So what we're going to do for you today is we're going to lay out what does the literature actually tell us about blood flow restriction. So what is BFR? Really, it kind of depends on who you ask. If you look, for example, at the APTA's definition of BFR, let's look at that for a second. BFR is achieved through an application of external pressure over the extremities. The applied pressure is sufficient to maintain arterial inflow while occluding venous outflow distal to the occluded site. The goal is to enable the patient to make greater strength gains while lifting lighter loads, thereby reducing overall stress placed onto the limb. So how does ChiroUp define, or the Chiropractic Association define, blood flow restriction? Blood flow restriction is achieved via the application of external pressure over the proximal portion of the upper and lower extremities. Restriction of the upper and lower venous return can affect the neural, endocrine, and the metabolic pathways, thereby inducing desired muscular responses. So obviously, with chiropractic, they're going to go more to the neuro end of things, whereas both the BOC and the APTA are more on the muscular changes. So for most of us, blood flow restriction is something new, something that we just started to hear about. But has blood flow restriction been around very long? Well, let's look at the history of blood flow restriction. It all started back in the 60s with Dr. Sato. After sitting for an extended period of time, he felt like his muscles were really fatigued. In the early 70s, he actually had suffered a catastrophic injury. And from that injury, he actually started to doing some tourniquet type of techniques to help him with his rehabilitation. And then back in the 80s, he actually started to apply this with weightlifters. And they were seeing such a great benefit from this that he actually started to develop some formalized research around what is blood flow restriction back in the 90s. So although we may think that this is something that is new, that's only come out in the last 4 or 5 years, it's actually been out since the 60s. It's actually been used a lot in the performance industry, in the bodybuilding industry, since the 60s and 70s. So although we think that this is something that is very new, it's actually started in Japan and has been well researched in that area. So one of the myths that we're going to talk around with BFR is FDA approval. What does that truly mean? A lot of products will say that they are FDA approved, but maybe what they actually mean is that it's listed with the FDA. The FDA does not approve these types of products. We'll talk about that in a moment and how BFR is classified. The other thing that you hear often is that you must use FDA approval product or you risk your practice. And that just simply is not the case. We're going to talk about how does the APTA define what kind of training that you should take as a physical therapist, or BOCA as an athletic trainer. What type of training should you take to use these types of devices? And then finally, the FDA requires that you take my class. You should simply take a class because you desire to learn from that class. The FDA does not dictate what kind of class that you should take, nor does the FDA dictate that you actually have to take a class. So how is BFR registered or listed as with the FDA? Let's look at some Class 1 medical devices that are also in the same classification as BFR. For example, a cane or a bedpan, a treadmill. Ice packs are also in the same class as BFR pneumatic and BFR non-pneumatic devices. So when we think about this FDA approval process, is it really just a listing? or is an actual FDA approval. FDA does not approve these types of devices. What some of the requirements require is that you actually include instruction on the device. That's simply you open the package, there's some instructions in there. That meets that requirement. It does not require that you take a special class or a particular class in order to use that device. So one of the other myths around the FDA is that you actually have to take a particular type of class. Let's look at this myth for a moment. FDA requires that clinical users be trained because the various professional fields do not provide training as a part of regular education process. But if you look at the APTA, you look at BOCA, you look at all of these other professional organizations that lay out what we should be learning, how we should be educated to provide certain techniques, that's just not the case. For example, let's look at what the APTA says. And we've provided you with the link here so you can actually download this yourself and take a look at it. Physical therapists have existing firm foundation in anatomy, physiology, therapeutic exercise, and cardiorespiratory system, as well as clinical reasoning, which are the components for the safe application of blood flow restriction training. That's what the APTA says. So to think that we have to go to an extended course to actually learn how to apply blood flow restriction, or we're going to putting ourselves at risk clinically, our license is at risk, is just not the case. Our basic foundation in education, what we learned in school, is a foundation from which we should be able to apply these types of techniques safely. Now, that doesn't mean that you shouldn't go to a course. It doesn't mean that we shouldn't seek further knowledge. It doesn't mean that we shouldn't be looking at the research. What it means is that you're not going to be putting yourself at risk for your license at risk simply by applying this type of technology if you've not had a course. Now, again, we want to make sure that we're doing a course if we don't feel comfortable doing that, or we don't feel comfortable with the knowledge base that we have. That's okay, but we're not required to do that. So what does BOCA say? BOCA is for our athletic trainers. If you look at this slide, we have listed the link down there for you, so you can actually go to this. Don't take my word for it, actually go to the document itself. And what they say is that ATs are healthcare professionals and fall under the scope of clinicians qualified to learn and perform BFR. Rehabilitation of patients by healthcare practitioners using a device clearly comes within the scope of cure, treatment, or affect the structure of any function of the body per the FDA definition of the medical device. Again, all of our professional associations are laying out what their position papers are on blood flow restriction. Simply stated is that if you desire to take a course, you should take a course. If you desire more information about blood flow restriction, you should do it. But you're not required to take that because you're using a device. This device, the blood flow restriction device, you're not required by the FDA, and you're not putting your license at risk if you do that. Now, all of that being said, there are some devices out there that require that you take their course in order to use the device. Now, that's your desire. That's your choice. If that's the product that you decide to go with, and those are the conditions under which that functions, then you got to do that. But again, in order to use blood flow restriction, you do not have to use an FDA-approved device, and you do not have to take a course. And if you don't do that, you're not putting your license at risk. At the end of the day, we want to do what is in the best interest of the patient. And at the end of the day, if we need some continuing education to do that, then we should do that. But you're not required to in order to use a device.